Two councillors, Councillor Jeff Watson, Councillor Guy Renner Thompson, to this call.
Thank you.
So off we go. Apologies for absence. Andrea?
We have apologies from Paula Mead, David Thompson, Ralph Firth, Pam Travers, and Siobhan Brown.
Right. Any more? I cannot see. Minutes of the last meeting, which were held remotely on the 13th of August. You have them. Does anybody wish to bring? And Susan, can I ask you to put your... Susan?
Sorry, yeah.
We can hear everything you're doing. Thank you. Does anybody have anything to say on this, on the minutes of the meeting, of the last meeting? Anybody? Looks like a no. Let's move on. Disclosure of members' interest. Anybody? Cannot see anybody. Right, item 4, items for discussion. 4.1, report of the Director of Adult Social Care and Children's Services. Over to Liz Morgan. Liz.
Thank you very much, Chair. So you've got the report, and hopefully you've read that. What I'll do is I'll just sort of briefly update you on some of the figures, and then talk to you about some of the actions that have been agreed at the Health Protection Board in response to the increasing rates that we're seeing in Northumberland. So we are, along with the rest of the North East, actually seeing increasing numbers of cases across the county. I say across the county, actually. You know, the vast majority of those are in the southeast, and that's probably not unexpected, bearing in mind that that's where, you know, a larger proportion of the population live. So we've now had a total of 1,748 cases reported, and over the last week we've had 56, which was a slight drop actually from previous weeks, and 90 over the previous fortnight. So bearing in mind that at the beginning of August we were, you know, I think we had 6 or 7 cases that week, you know, that is a significant increase in the space of 6 weeks. What we had been seeing is that a large proportion of those cases were in people in their 20s. So whereas at the end of June, the average age was 50, last week we were reporting an average age of about 29. Looking at the most recent week's worth of data, that average age is now creeping up. Now, obviously, you can't draw conclusions from 1 week's worth of data, but it is of concern to me that the average age is increasing, because actually what we don't want to see is the age of, or the cases escalating through the age bands, because we know that people who are older more likely to have long-term conditions at higher risk of consequences from COVID-19 infection. So we're looking at that very closely. In terms of the sort of Health Protection Board and the sort of things that we have discussed this week, you'll know that you'll know that South Tyneside and Middlesbrough are now part of the government watch list. It's likely that a number of other local authorities in the North East will be added to that watch list over the next few days. It's Durham and Northumberland are probably less likely to be considered, because our rates are still slightly lower than other local authorities in the North East. But actually, if things continue, we may well be in the same position over the next few days or weeks. So we agreed as a Health Protection Board that we needed to ramp up our response effectively. We have agreed that we're going to start doing something called backward contact tracing. So that's basically having a much more in-depth conversation with cases that have already been identified and contacted by NHS Test and Trace, so that we can get a much better understanding about where they've been, who they've been associating with. It's like a structured interview, and the purpose is not to find contacts and specific sources of infection. The purpose of that conversation is to find transmission networks, be they households, social, hospitality venues, to get a better understanding about the age groups that are affected, the geography, where they've been in the week before that they became unwell. The value of doing that is in providing us with some much more detailed information about where we concentrate our efforts in terms of interventions. So if after a dozen conversations with a group of individuals, we find that a particular venue is coming up as a common theme, then we know that we need to do some proactive work with that particular business or workplace. So we are working to get that process up and running as soon as we can. We had a conversation about contact tracing, and we've agreed as a regional group of directors of public health that we are going to work with Public Health England to put in place the same sort of contact tracing process which has been put in place, or a similar sort of contact tracing process which has been put in place in areas like Blackburn and Darwin and Leicester. And the principle of that contact tracing process is really to pick up those individuals who, after 24 hours, have not engaged with NHS Test and Trace. So after 24 hours, a list of those individuals will be passed to the local authority, and we will then try and contact those individuals locally to have a conversation with them, to give them some advice, to identify their contacts, and then all of that information will be passed back to NHS Test and Trace. That's quite a significant bit of work to put that model in place across the whole of the North East, but we feel that that's an important thing to do. We've also agreed, because the public health system across the board is creaking at the seams, to be fair, there is a significant amount of pressure on Public Health England, particularly with schools going back. They've had over 442 inquiries last week, of which about a third were related to schools. That's increased even more this week. They've really been quite under a lot of pressure in response to questions from schools. So we've agreed that the local authority will take on the management of the vast majority of inquiries relating to schools. So that's any inquiries about possible cases, confirmed cases in schools, and providing the information and the health protection advice required by schools to respond appropriately to those situations. That's clearly putting a pressure on us as a local authority, certainly the education team and and ourselves as a public health team. But we're developing a really good system to just make sure that we do pick up all of those calls and respond to them appropriately. We've got a meeting with head teachers later today to provide them with some more information about how we do that. I'm very conscious that GPs have also been called by schools and by anxious parents. So we're hoping that by putting this process in place, that will certainly take the pressure off of GPs. We've talked about the risk to care homes. Several other local authorities in the North East have closed care homes to all but non-essential visits. Now, we're not in the same place in terms of case rates as some of those areas. So South Tyneside, Sunderland all have case rates which are much higher than us. But North Tyneside has also put some further restrictions in place on care home visitors. So we are looking at what our response should be in Northumberland, and should be working that through in the next couple of days. The other thing that I wanted to talk about was about testing, because you'll appreciate that there has been a lot of noise in social media and nationally about testing, and that's really coming out when schools return, because we have had a number of children who have been symptomatic and who've been advised to get tested, but of course a lot of parents have then struggled to get their child tested, and we've had stories of parents driving their children from the south of the county to Galashiels to get their child tested, which is clearly not ideal. We have done some rough analysis on our own data, because for the last couple of weeks we've also been getting not just the data on positive tests, we've also been getting the data on negative tests, and that has been a real eye-opener. What that initial interrogation of data has highlighted to us is that in Northumberland, about a third of tests have been undertaken in people with no symptoms, and that's even taking out tests in hospitals and tests that we know have been undertaken as part of the routine whole care home testing process. So this is people in the community who are getting themselves tested with no symptoms. We also know that there are higher rates of individuals with no symptoms getting themselves tested in our more affluent areas. So this is the worried well requesting tests when they have no symptoms. And of course, the testing process is designed for people who have symptoms. So part of the reason why the national testing process is under such a lot of pressure is because we have a large proportion of the population who are getting tested unnecessarily. We have some individuals who are getting themselves tested every week. There are some people who have had over a dozen tests, and for all of those tests, they've had no symptoms. So, if one message comes out from the meeting today, it's to emphasize that the testing process is for people who are symptomatic. It is not designed outside of those whole care home testing processes. It is not there for people who do not have any symptoms, and neither can getting a test shorten your quarantine period if you're coming back from one of those countries which requires you to quarantine. The other bit of work that I just wanted to highlight to you was about local testing sites. So we were very keen to get a local testing site in Ashington and Blythe, because we know that those are areas where testing uptake is not quite as high as we would like it to be. So we've identified 2 sites. One of them will almost definitely be going ahead in Ashington. The other site we have some slight concerns about. We might need to look at somewhere else in Blythe, but we're working very closely with the Department of Health and Social Care to get those testing sites in situ. And that could potentially also provide some more testing capacity for people who are in the vicinity of those areas, not necessarily in those areas. I think in terms of the sort of wraparound support teams, I think I'm very thankful that I've got colleagues across the local authority who've really picked up this work and run with it. The educational settings team in particular has worked incredibly hard this week to accommodate the number of queries that have come from schools. As I said, we've got another session with head teachers this afternoon. Again, businesses and workplaces, weekly meetings are taking place with a workplace business group to look at how we support businesses, and also think about how we reprioritise some of our existing routine activity, which is done by environmental health and public protection officers, and both increase capacity, but also reprioritise what we do to support the COVID-19 work. I think the announcement to put into legislation some of the things that have only so far been guidance will be quite helpful. The care home working group, again, working really hard to support those care homes. I think our care homes are pretty effectively cocooned. They've got some very comprehensive guidance. They continue to get 7-day support through our infection prevention, well, the Trust's infection prevention control team, and that's a really good example of how we work collaboratively across the system. I don't know whether there is anybody on from comms.
Yes, Anne.
Yes, Anne's on.
Yeah.
Because there is I think the last thing to note is really the amount of work that is going on from a communications perspective. And Anne, I just wonder whether you'd be able to give a sort of bit of a brief update on what we're doing from the comms and engagement point of view.
Yep, absolutely, no worries. So the local campaign is well underway. That's around protect yourself, protect others, protect Northumberland, and around doing your bit. We've got that's going on all available channels. We've refreshed our town centre signage across the county. But also exploring the use of using hoardings and signage, and particularly around school gates. We've had a bit of feedback from schools as they've returned around parents perhaps not social distancing. The kids are doing fine. It's the parents that are the issue. So we're looking at putting some signage around the school gates just as a timely reminder to those. All of that is supported with PR and everything, an integrated campaign across social media. We're doing more targeted messaging as well, paid for and boosted posts around social media, particularly around the early 20s age range, and we have had some issues with them in terms of the increase in cases. We've also done some targeted comms with visitors over the last few weeks of the summer holidays so that they know what to do should they become ill, and we've done significant targeted comms with businesses, both in terms of tourism businesses. So they've had collateral, leaflets, posters and what have you to let them know what they need to do, but also in terms of the hospitality trade as well. So the pubs and restaurants know what they need to do in terms of their duties around applying all the guidance, the social distancing and recording of test and trace. We have had some feedback and reports through from communities and of course our elected members as well about the lack or the mixed picture of that reporting through test and trace by businesses. But of course, as Liz has just mentioned with the announcements last night about that being mandatory, we'll really get flying with that and make sure that we get those messages out. My team are already doing that this morning. We've got messages going out in Northumberland News. Our residents magazine goes out quarterly. That starts hitting doorsteps from Monday the 14th. So we're using every possible opportunity, every channel available to us, and doing targeted when it's needed to reach different audiences. New national campaign is launching today, so you will have seen some of that last night, and the announcements that were made around hands, face and space, and of course we'll amplify that. And of course we'll do what we need to do around the mandatory test and trace with businesses. We're also working with Claire's team and the Trust and regionally with ICS around their campaigns around do your bit. So that's the kind of talk before you walk, flu, etc. So we're working with the team on doing that. We're using it as original content, Claire, rather than sharing because it's working better for us. We've done some analysis on that and it's really getting some traction. So I think that's probably it. Like Liz described, there's significant comms going out across the piece. We're also working with local authorities across the North East as well. Some may have seen that there was a joint statement went out across the 7 local authorities plus the combined authorities that splashed on the Journal yesterday morning around everything that we know are the issues. Around just a reminder of what people need to do. There's increased cases, it's getting reported everywhere, and now more than ever everyone needs to really do their bit and step up to the mark. Schools are back now, people are starting to go into the workplace, students are going back into universities, so we're speaking to the universities and colleges as well about how we can support that too. So happy to take any suggestions about gaps and new ideas and what have you. We're looking at other things around digital advertising, but your standard advertising, just bus backs. There is more traffic on the road, so everything that is available to us, we're planning to use.
Okay. Before we move on, there is a tiny bit of interference coming through, and I can see from my screen, Margaret Young, you're not muted. Yeah. Margaret, I can still see you're not muted. That's where a little bit of noise is coming from. Thank you. I've got two. I'll go to Jeff and then Susan. Jeff, can you unmute? Jeff? You need to unmute, Jeff. I'll go to Susan. Susan.
Thank you. Thanks for that update. Just before we start, I'm actually on holiday in the Yorkshire Dales this week, and I have to say the wearing of face masks and the businesses insisting on customers registering is much higher here is at home. No, except I don't live in a tourist area at home, but we have not been served even to drink outside in any before we've registered our contact details. So I think it's noticeable, the difference. Have we got a time scale on when the test and trace centres are going to be opened in the southeast of Northumberland? Because I'm really concerned that the figures are backing up what we know, that because of the size of population, as well as the demographics of that population, the numbers are higher of people who are being confirmed with COVID in the southeast of Northumberland. I have been asking for probably a month now for to be testing centres in those areas, and we're still talking about it's rather than it being in place. Because if the numbers are already higher from those areas, we know that it's community transmission is well and truly established now. So the numbers, I would suggest, are higher than those that we currently have because of the lack of easy access to testing. And I can probably say this and you can't, Liz, because I'm a councillor, but you say it's not ideal, somebody having to travel from the south of the county to Galashiels to get their child tested. I would say that's actually unacceptable. It's not just not ideal. So there's a question in there. There's a question around what, and I know this is a bit of a flanker, but what's happening about dentist services in Northumberland? Because my dentist in Morpeth is still not open and are not even answering the phone to calls. So, I think as an ongoing health issue, there's an issue around dentists. Care homes, I would be keen for us to be overcautious again, like we were previously, rather than under. And though I absolutely accept, I've got elderly, frail parents who I'm still managing-ish to support at home. I absolutely understand the heartbreak about not being able to see people, but I do not want us to go back to the situation we had in care homes. And if it's out there in the community to the extent that we now feel it is, that will be where it goes next. I think
Can we get going on that list, Susan?
No, I've got that.
I agree.
Thank you.
I agree with the testing. I mean, you're aware we Susan, Jeff, etc. We had a full council last Wednesday. I had a little cough. It went to a little bigger cough on the Thursday, and on the Friday I rang Kelly Angus and I said, "What should I do?" You were all in the room. She said, "Go and get tested. Here's the number." I rang it, so I ended up an hour and a half later at Carlisle Airport. That's where I was sent, which
it just is not good enough, and I know it's not down to us. And I preface everything I say at these meetings with this is not a criticism of what our staff are doing, which I think under the circumstances is absolutely amazing. But we need to continue to put pressure on the government about the testing situation, because, you know, we've been in this mess since February, and it doesn't seem like it's been sorted whatsoever. And we're fast heading into winter with transmission rising, and it's really scary.
Right, before I go to Jeff, Liz, do you want to reply or respond to any of that?
Yeah, certainly. So in terms of the testing sites in Blythe and Ashington, we've had, well, we're just about to have our third meeting with the Department of Health. So the Department of Health is responsible for testing, and they are responsible for putting the, well, we're responsible for identifying the site. They're responsible for putting the local testing site in place. But, you know, it does potentially require removing, you know, walls, gates, putting a significant amount of infrastructure into a site. And of course, that all takes time. But I can assure you that I am pushing it as quickly as I can. Obviously, the other issue to take, or the other issue that we need to bear in mind, is that, you know, there are a load of other local authorities that are also trying to put local testing sites into their areas, and we're, you know, in a queue to have our local testing sites put in place. But, you know, we are pursuing it as quickly as we can. With dentists, my understanding that dentists were able to open. They weren't able to see as many patients because there's quite a significant level of environmental cleaning, etc., that needs to be done between patients. But certainly I can take the issue about access to dentistry up with NHS England. And then with regards to care homes, I completely agree with you. We need to take, you know, a very precautionary approach with respect to care homes. You know, I really don't want to see, I don't want us to get back into the situation where we were back in April with 45 deaths every week, the large proportion of which were in care home residents. So, you know, I completely agree with you. We need to be very precautionary about that. But yeah, the dental thing I'll take back up with NHS England.
Okay, Councillor Jeff Watson.
Yeah, three quick points. I wasn't going to say anything about this, but dentistry, I'm sure the case is that they're seeing emergency patients, not doing the normal stuff. I know that for a fact because my wife's had 2 appointments with her dentist. So that is happening. As regards care homes, I hope we're going to be very cautious with this. I think we should look very seriously at cutting back on non-essential visits. I really do. And the thing I really want to speak about was the schools and meeting at the school gates. I hope the meeting you've got this afternoon with the headmasters will have that on the agenda as one of your issues to discuss about how you're going to cope with that. Also, one wonders the new rules about social gatherings of no more than 6. How we're going to deal with that at school gates. I think that's a question for headmasters and mistresses to figure out. I've already had, you know, lots of comments from people who are seeing the kids coming out all nicely socially distanced and then mingling with a crowd of mums and dads and grandmas at the school gate, and it's putting out a wrong message, and it isn't safe. I know, Liz, I've already said this. I know you've got it on board. I just want to re-emphasise it. Thank you for letting me speak, Chair.
Okay, Guy Renner-Thompson.
Thank you, Richard. I had the regional lead members for children and young people meeting the other day, and they brought up the issue of schools not getting very far with the national public health team and the local public health team, such as yourself, Liz, having to take up the slack. Is that still a problem for you?
Well, we agreed on Monday with Public Health England that we would start to take on that workload from them. And that literally started the following day. So, you know, actually for the whole of this week, we've been to a certain extent firefighting, but ensuring that schools did have a response in a timely way. And certainly the schools that I've spoken to have been, you know, they're just so grateful to get some advice. And, you know, a lot of the time it is just reassurance. This is, This is all information that they know. It's in the frequently asked questions document that we've provided to them. It's in the, it's in the flow charts that we provided to them. But I think, they're out of their comfort zone. So they are, really keen to get some reassurance from us. So yeah, we'll be picking up that workload in the longer term, and I know that the education support team, or education wraparound support team, had a meeting yesterday afternoon to come to a decision as to what the process would be for schools, because obviously we need them to use a central point of contact so that we gather all those queries in through a central point, and we can then manage them much better. But at the moment, they've been coming in from HR, through email addresses. Some of them have been using the Google form that we'd set up for them to, for that purpose. So we need to get that message across at the meeting this afternoon, and just clarify for them the process that we want them to use.
And then another one, Chair. I get with where I represent as a ward member, I get a lot of queries and worry from people about the number of visitors and whether that's going to have an impact on the coronavirus numbers. Is there any proof that the number of visitors we've had has affected the number of cases, or is that just an unfounded worry?
I think we might have anticipated an increase in the number of cases based on the levels of tourism, but actually that hasn't really been borne out in the cases that we've had. The cases that we have had linked to tourism have all been linked to people who've been abroad. So we have had a number of people who've come back from holidays abroad and tested positive, but really there's no evidence that any of our cases are anything other than homegrown.
No, thank you, Liz.
Okay. Anybody else? Yes, Susan? Yeah, you've unmuted.
Sorry. I just think listening to the general frustrations and hearing what Liz was saying about, raising it. Is there a role for this to be raised politically rather than through the professionals all the time? Because the decisions that are being made are political decisions, actually. So I suppose that's over to the leadership of the council, that can we raise this at a political level rather than just at an officer level all the time?
Fair point. I can answer that one next week. And I know that is not satisfactory, but that's the way it is. Right, anybody anywhere else to speak? Liz, thank you for that. I'm now going to go to 4.2, the Northumberland Flu Plan. This is back to Liz, and I think it's Rachel Mitchison with that. Liz.
Oh, I'm just going to hand over to Rachel.
Oh, right. Rachel, where
Hello?
are you?
I was just waiting to see what Liz was going to say, that, but that's fine. Hi, my name is Rachel Mitchison. I am a director at the CCG, just to give an update on the Northumberland Flu Plan. Also presenting with me is Dr. Paula Batsford, so we're going to do a little bit of a double act. I know you've got the slides that we can kind of talk through. So flu this year is quite a challenge. Just from a point of view of just some numbers to give you an idea, last year in Northumberland we vaccinated 64% of the sort of eligible population, which is about 2.6 million people eligible, and this year we've got an even higher target and an even higher eligible group of people to vaccinate, and in that sort of socially distanced way, which is quite a challenge for our primary care colleagues who really do the bulk of the vaccinating. So what we did was pull together a local coordinated group. So the CCG lead that, but we've got all stakeholders on that group, from primary care, local authority, public health, community nursing, and community pharmacy and secondary care. And that has been meeting on a weekly basis in order to pull together a plan. There's been a lot of national guidance and there's a lot going on at ICS level, and so we have also linked very much into those groups for that national and regional guidance, but we very much felt we needed a very strong local plan, which is why we pulled the collaborative together. There's been a lot of work around CQC requirements, if we couldn't vaccinate within normal health buildings and if we could use other buildings. So we've been finding out about those requirements. Clearly, infection prevention control has been very key. PPE and whether to wear it or not wear it, and wearing the guidance has been a big challenge, but that's been relaxed, which has made that much easier, and all the cold chain requirements are again quite a challenge, particularly if we use other venues. We want it to be really clear around the priority groups of patients, and we also needed to understand the sort of capacity and demand, and how many vaccines we've got. Obviously, all the practices order their own vaccines. Community pharmacy have their vaccines, as well as the hospital trusts have theirs. So we have pulled together a plan so that we know how many vaccines we've got in Northumberland and where they all sit. We did a survey to around our primary care colleagues, who again do the bulk of the vaccinations, and they pulled together the priority list, which is on slide 3, and we wanted to have a plan across Northumberland so that we all work to the same priority groups. So clearly this year we've got the shielded groups. Our care home residents are very high, the over 65s, long-term conditions, learning disabilities carers, pregnant people, and Black and Asian and ethnic minority groups, who are not on there because they have a higher risk of flu, but just because sometimes they are a harder to reach group. So it was just about making sure that they were aware of the flu plans and flu clinics this year. So I'm going to now hand over to Paula to just run through our vaccination numbers and where they are. Thanks, Paula.
Thanks, Rachel, and good morning, everybody. So you'll receive the presentation. So the ask this year, our population figures, the over 65s, we've got just nearly 82,000 to deliver. In our at-risk group from 60 to 65, we've got nearly 43,000 people who are eligible. There is some overlap there with the 50 to 64, which is the new group that have been brought on and who will be given the opportunity, if they don't fit into any other groups, to receive the flu jab towards the end of the campaign, sort of November time, when we know what sort of numbers of flus are going to be available. We estimate there are going to be about 2,500 pregnant ladies, about 4,000 people who are carers, and then we've got the children, the ages 2 to 3 years, and then up to year 7 for schools, which is 30,500 children who are eligible to receive the flu. So they're big numbers for all of the teams that are involved to try and deliver those flu vaccinations too. All 39 of our GP practices have signed up to deliver the vaccination programme.
We've lost her, I think.
Have you lost me?
Yeah, we lost you momentarily.
Oh, sorry. So all of our practices have lots of experience in delivering the flu, and we knew early on that there wasn't necessarily going to be a national plan of how to do this. So we very much engaged with our practices early on to say this is going to come down to you and you making the plans to make this work. And we feel very reassured that the practices are ready to do this, and we're there to support them with any issues that may arise. Our community nursing teams have been very involved and are ready to deliver vaccines to the residents and also to our housebound population. and we've worked very closely between the community teams and the primary care team to make sure that those lists of people are they've been coordinated and that they're prioritised. The FT and CNTW are obviously going to be doing a mass vaccination programme for their own staff, but they are also hoping to be able to target people that become hospital who would be eligible for the flu, and to be able to give them their flu vaccinations while they are there on site at the hospitals. Our health visiting team are helping us to promote the uptake in the ages 2 to 3 by signposting them to the GP practices. It's the GP practices that will be delivering the flus to the 2 to 3 year olds, and then we're supported by Northumbria FT and the school immunisation team to do from ages 4 to up to year 7. There are challenges for them this year because obviously with opening it up to year 7, that now crosses, so some will be in primary schools, some will be in middle schools, and some will be in high schools. So it has opened up more places that they've got to go to reach that year 7 group. So they're having to work very hard to be able to cover all of those additional children this year. We're also supported by our community pharmacy colleagues. They delivered about 12,000 flus in 1920, and this year they have about 20,000 flus that they've ordered into the community. And they are keyed up to make sure that they prioritise the groups that we would like to see prioritised as well in the first batches. So as I said, there's a much wider flu cohort that we've identified this year that need to have that delivery. We are prioritising the groups that we feel are most at risk and most vulnerable first. We've got a very experienced, as I said, primary care team who are going to deliver this for us alongside all of our other support in the other teams that are involved in this. We're continuing with our weekly meetings and making sure that that all goes ahead well, and we're there to support each other. We are aware that as Rachel mentioned, that we in primary care order all our flu immunisations in advance, and there was no opportunity for us to change those order numbers based on the requirement for the new groups of the 50 to 65 year olds. So there are going to be some national stocks, and we are obviously getting information all the time about how we will be able to access those. But we do know that at the moment, based on the numbers between all the agencies, the community pharmacists, primary care, the trusts, that there is a shortfall for that particular age group. But hopefully that will be matched through the national team and how they then go ahead with prioritising that across the country. Thank you.
Okay, any questions? Susan?
Yeah, the community pharmacies that always offer a service for flu jabs, how are we going to ensure that because we're going to run out of flu vaccinations when there isn't enough already, because they've extended the groups that we're targeting. So I suppose it's back to the worried well, who we would always encourage to have flu jabs as a matter of course, because it reduces it in the community. But actually this year we need to make sure that those priority groups get it ahead of people like me, for instance, who don't fit into it. So is there going to be a system in place to make sure that happens? Because obviously when people go to the pharmacy, there's a charge to that. So there could be a conflict there about people wanting to provide it in the places where people pay for the service rather than get it for free, and us losing the immunisation because of that. Sorry, that sounds
No.
Words,
Paula?
you know what I'm trying to say, don't you?
No, I can completely understand what you're saying, Susan, and it is a risk. At the end of the day, pharmacies are businesses, and it's an income stream, and it's very different from how that is in primary care and other settings. Certainly our independent pharmacy colleagues are very on board with making sure that we prioritise the most at-risk groups. we have less sway over the multinationals and how they approach it. But locally, I know we've spoken in our local PCN with our local, because we only have multinationals. I'm in Cramlington, we only have multinationals, we don't have any independents. We've spoken to our pharmacists and they are mindful of that, and they are looking to try and make sure that they do prioritise the right groups. But you are right, it is a risk, and particularly with those stocks of flus. But the willingness is there, but there is a risk, and we don't have control over that, unfortunately.
Is that something that we could make representation to government again, because they could direct where the flu vaccinations go, or is that something that isn't possible to do?
Do you want to answer that? Anybody want to answer that before I then go to Councillor Watson and Margaret Young? Can anybody answer? I think we it's a point. We'll come back to it.
Could I ask that it's looked into, please? Because I think it's a significant risk.
Yeah.
And I don't want to be sitting here in 3 months' time being told that it's happened and we haven't tried every avenue to try and stop it happening.
Okay, I've noted that. Yeah.
Can I just say that I know for a fact that the pharmacies, Lloyd's in particular, have actually sent letters out to people who they find priority. They came out in August.
Well, I hope there's plenty to go around. And it's still a do you have it or do you not question. And I know that everybody, I'm on the ambulance trust and they try to get all of their staff injected and they don't quite get to that 100%. I want to go to Councillor Watson.
Thank you, Richard. My question was really on the same sort of subject as well. I know last year we did have problems at the beginning of the vaccination process, and I'm disappointed that we're going to have it again this year. Although I can understand why if we're changing the parameters as a necessity. So I think the government is taking into account the increased risk and therefore acting as well as it could. However, can I just ask the question? Last year, did anybody not get the vaccine that requested it? I mean, was the problem one of delay rather than not being able to supply at all?
Paula?
As far as I'm aware, there wasn't an issue. So there wasn't an issue. Most practices end up actually returning some flu vaccinations most years, despite efforts to call in people. There's only so much capacity. Once you've had 3 calls in various ways, if you still haven't responded, then that's up to that individual. As long as we feel assured at a practice level that we have tried to contact them in various forms rather than just, oh, well, if we've texted them 3 times, as long as you've done a letter, a phone call and a text, then as long as you feel assured, then most years we do end up sending flu vaccinations back. I don't think that will be the case this year at all. I think people are much more switched on to the campaign at large, and that they want to now come forward, and those are people that would previously have been eligible. So in primary care we only deliver it to people that are eligible for the flu. Obviously in the pharmacies, yes, people could choose to go and pay to have it done even though they weren't in an eligible group. So but as I said, we are trying to avoid that as best as possible.
There must be some groups that are delivering this somehow, because I got a email message from Middleton Village Hall, which is west of Morpeth, and they said, I think it's this weekend, come and get your flu jabs. Yeah. So somebody must be trying hard to deliver it.
Yeah.
Right.
Yes.
Yeah.
Chair. Sorry.
I'll go to Paula, then come back to you, Susan. Right.
Yes, certainly in primary care, it's this weekend that the big flu clinics are sort of starting up. So flus have been delivered to some practices this week, and so they plan to start their flu clinics this weekend. So that will possibly be why each individual practice will be doing it slightly differently, and will be calling their patients in different groups and on different days. But they will all be starting in the next 7 days.
Okay, Susan?
Yeah, I just wanted to ask Anne what we're doing as a local authority in terms of advertising this. How are we promoting it?
Well, I think we need to work with a team, with Rachel and Paula's team, really just to understand the timings of that. But given the complexity that's outlined, it's really important that we do it in a really simple way too. And obviously working with Claire's team as well. It's different this time round because there's more groups involved. So we'll commit in the next week or so just to understand that timing and make sure that we're crystal clear on the comms around it.
I think that's really important, Anne. I think, and Susan, what we don't want is practices being flooded with requests that they're not yet ready to go ahead with. So certainly we have communicated at our practice level that we're doing our shielding groups first and our more hard to reach groups. So anybody else that was ringing up in the early stages were saying, just hold fire, we will get in touch with you because we are planning our clinics so that we can prioritise appropriately. Because every practice will be doing it slightly differently, I think whatever comes out as a sort of regional comms has to be a more generic, your practices will be holding flu clinics. Please, if you are eligible or you think you may be eligible, please get in touch and they will advise you how to go ahead with that.
Yeah, I mean, it could be something as simple as soon as you get a letter from your practice, please respond and get it, because you're right, it'll be done at different times, but just that's it. When you get the letter, get it done.
Yeah.
Okay.
The other thing that we are aware of is there will be a national letter sent. So there is a letter that is going to go out to people as well to encourage the flu. So that's coming out. But I see Claire's got a hand up because she's been involved with the comms.
Okay. Claire?
Hi, yeah, thanks, Councillor Doug. The plan is pretty much signed off with a view that there'll be a bit of a media launch next week across the region, really focused around flu jab. From a communications plan point of view, exactly what Paula has suggested, that actually we need to focus on some of the priority areas in the first instance, and the comms plan is actually has been created in a phased way to do exactly that. Each of the local teams will have a template. They'll be able to localise that and really push out across in their areas and localise some of the messaging that is pertinent to their area and the normal way that you would talk about different areas, and making sure that it's localised appropriate. But we're pretty much there with a view that the media launch will be next week.
Okay. Any more on this one? I cannot see.
Richard, I'm waving.
Oh, so you weren't on my screen, Kath. Carry on.
That was good. Just to say also, in terms of frontline staff who might not necessarily be eligible in any of the categories, we also look to see how we can support them in terms of getting jabs, because they're going out obviously into people's houses, and we want them to be to be afforded that protection. So that forms part of any plan that we have around managing the process of making sure that we encourage and facilitate everybody to get a jab where they can. So we're already looking at how we manage our frontline staff, both in adult and children's services, to do that.
Okay. I see no more hands, even the ones I can't see. Right. Okay. Item 5, urgent business. Liz, do you have any?
No, I don't, Chair. Thank you.
Right. Okay. 10:55. We're on course. Date of next meeting will be the Thursday, the 8th of October at 10 a.m. So thank you for your attendance, and hopefully that has given you lots of information. So we'll see you at the next meeting, if not before. Okay. Thank you very much.
Richard. Thanks, Liz.